What's that? Hello, everyone. All right, guys, I just got finished with Instagram and I wanted to bring these practice questions on to TikTok. Okay. All right, NCLEX Jeopardy. If you don't know, if you haven't played before, this is just our really fun game style, game show way of reviewing for our NCLEX, reviewing NCLEX practice problems, but just in a fun way, right? It's all about the experience, all right? Nurse Sam Global Media and me, Nurse Sam, my whole goal is to help nursing school become an experience, you guys, a learning experience that's actually enjoyable so that you retain more. So we do fun things like NCLEX Jeopardy or Tease Jeopardy. All right, this is just a great way to study for the NCLEX. These are traditional NCLEX problems. On Sunday, we'll do case study sessions. So we'll go over case studies for the next gen, but for now, we're just gonna go over these traditional questions, okay? First one's up. This one is fundamentals for 400, all right? This one says, the nurse is caring for a client who needs a hypertonic IV solution. What solutions are hypertonic? Select all that apply. Don't you just love that phrase? All right, so the answer choices that we have are 10% dextrose in water, 0.45% sodium chloride, 5% dextrose in 0.9% saline, 5% dextrose in 0.45% saline, 5% dextrose in 0.225% saline, or 5% dextrose in lactated ringer solution. All right, this is a select all that apply question, so you know what that means. It can be as little as one of the available options or as many as all X amount. Here we have 6 questions or 6 answer choices, so it can be as much as all 6. All right, so what you guys are going to do is you're going to actually type in your comments and type what your answer is going to be. Okay, so let me know what your answer is. What would you say this answer is? And remember, this is NCLEX Jeopardy, so you have to play Jeopardy style. You got to say what is, all right? Whoever gets the most amount of points at the end of this little mini live, you'll get a free Ultimate Nursing School bundle. How about that? All right, so let me know what your answers are. All right, I got one answer. It's 1, 3, and 4. Does anybody else have answers that they want to? We're going to go over the rationale and the answer and everything like that. All right. So 1, 3, 4. Great answer. Remember, if this was the actual NCLEX, with the next gen NCLEX, it does offer partial credit with the 3 new scoring models that they have introduced. You do get multiple credit for multiple response questions like this. So you'll get 1 point for every correct answer and either 0 points or you'll get a negative point for everyone that's wrong. All right. Owen says 1, 3, 6. All right, let's look and see. Does anybody else want to go? If not, I'm going to go ahead and get the answer so we can go on to the next one. Yeah, no, yeah, no. All right, let's look and see. Let's change our answer. How about that? All right, so the answer to this question is 1, 3, 4, and 6. Ooh, so close. Pink, Glocks, and Owen, if you guys would have like combined your scores or combined your answers, it would have been this. You guys both got 3 out of 4 correct. So you would get like 3 points instead of 4 if this was the actual NCLEX. That's okay. Listen. The whole reason for us practicing is that you can get it wrong during things like this. So it doesn't count. So that when you take the NCLEX, you'll know what to do. You won't get got again. All right. So the answer was 1, 3, 4, and 6. Those hypertonic fluids include that 10% dextrose in water, 5% dextrose in 0.9% saline, 5% dextrose in 0.45% saline, and 5% dextrose and lactated ringer solution. So it was 1, 3, 4, and 6. All right, the solution that had 0.45% sodium chloride. They tried to trick you with the 0.45%, but it's not sodium chloride that is hypertonic. It's, it's a saline. All right. And 5% dextrose and 0.225% saline, those are not hypertonic solutions. Just period. Okay, so those are the correct 4 of the answers. Make sure you guys are reviewing your hypertonic, hypotonic, and isotonic. All right, very important for like biology and anatomy, and also for questions like this. This is fundamentals. All right, this is talking about IV fluids. If you have the Ultimate Nursing School bundle and you go to the IV therapy page, you'll see that we have, IV therapy study kit, I'm sorry, the one that's like Beyonce IV Park themed. You'll see that there's a page in there about the different types of fluids. Okay, so make sure you're looking through that because it'll give you the types of fluids. You need to know at least 3 or 4. You need to know all of the fluids that are, whatever type of solution. Hypertonic, isotonic, hypotonic. You need to know all those solutions so that if you get another question like this and it's about hypotonic solutions, you'll be able to get that correct. Cool? All right, let's go ahead and get into the next question. And let's do... let's do... adult health. Let's do adult health for 400. All right. This says a client with tuberculosis whose status is being monitored in an ambulatory care clinic asked the nurse when it is permissible to return to work. What factor would the nurse include when responding to the client? 1, 5 blood cultures are negative. 2, 3 sputum cultures are negative. 3, a blood culture and a chest x-ray are negative, or 4, a sputum culture and a tuberculin skin test are negative. What is our answer? What is our answer? All right, Pink Glock says 1. Wait, no, what'd you say? No, Pink Glock says 2. Naya says 2. User, a bunch of numbers after that says 2. We have 3 people. Lil Cox, Zyra, they say 3, which is a blood culture and a chest ray that are negative. It's like the battle of the 2s and the 3s. So let's see what our answer is. All right. Remember, you need to be able to ask yourself and be able to answer why you got the answer you got. So why, if you chose number 2, why'd you get 2? If you chose number 3, why'd you get 3? Ask yourself before the NCLEX asks you, because then it'll count for a point. You feel me? So, ask yourself that, and let's see who got the answer correct. Is it 2? Someone said it's absolutely 3. Lil Cox, why is it absolutely 3? All right, let's get into the actual answer. Hold one. All right, and the answer is, wait, I did it wrong. The answer is, what was that? Not health assessment. That was adult health. The answer is 2. Okay, don't look at where it says 5 blood cultures. I copy and paste the wrong one. That's from 1. But the answer is 2. It's the one that says, what was number 2? Hold on. The 3 sputum cultures. All right. It's not the 5 blood cultures. Sorry. It is number 2. But the actual thing is the actual wording is incorrect. I copy and pasted from the wrong one. So it's number 2, which was the sputum cultures, the 3 sputum cultures. Okay. Go back and just make sure. Yes, it's the 3 sputum cultures are negative. Okay. So ignore where it says 5 blood cultures. Ignore that. It should say 3 sputum cultures are negative. That is the correct answer. So for those that said number 2, you are correct. Great job. This is the rationale. All right. It says the client with tuberculosis must have sputum cultures performed every 2 to 4 weeks after initiation of the anti-tuberculosis medication therapy. Okay. The client may return to work when the results of 3 sputum cultures are negative. All right. Because the client is then considered non-infectious at that point. Okay. But it can't be 1. It can't be 2. It needs to be 3. 3 is a lucky number. It needs to be 3 back to back that are negative. Okay, the other options are not reliable determinants of a non-infectious status. Okay. All right. Yeah, that's a good point. That doesn't say like, hey, you're good, you're clear for yourself. They're talking about specifically going back to work and being, able to spread it. So that was that answer. Great job. If you got number 2, let's go ahead and get on to the next one. Great job. I wish I had this in nursing school, right? Me too. That's exactly why I made it. Like, this would have been way more fun than no shade, UWorld, but it was just too overwhelming for me. No shade, UWorld, but I just couldn't do it. Like, I needed fun. That's why I created NCLEX Arcade, but we'll talk about that later. All right, next question, guys. What was that? Farm. Oh, let's do a classic. This one is a good old classic. You must know this. You will see it at least once. At least once in your nursing school career, I promise you. All right, this is Farm for 100. It says a client with chronic kidney disease is receiving ferrous sulfate. What is ferrous sulfate, by the way? What is that? What is that? Let me know. It says the nurse instructs the client that the finding is a common side effect / adverse effect associated with this medication. Is it 1, fatigue, 2, headache, 3, weakness, or 4, constipation? All right, I am seeing pretty much all 4s, and yes, all right, ferrous sulfate is iron, absolutely. Yay, Delaney! All right, guys, all y'all are saying 4, constipation, and I love it. Okay. One person didn't say constipation, but that's okay. We do not shame anybody for knowing the answer versus not knowing the answer. That's why we're learning, everybody. All right, so the answer to that is, drumroll please. That was a horrible drumroll. 4, constipation, but y'all knew that already. Great job. So the answer is 4. All right, ferrous sulfate is, like you guys told me, because you got it like that. It's an iron supplement used to treat anemia. Okay, constipation is a frequent and uncomfortable, obviously, side effect that's associated with the administration of oral iron supplements. Notice that it says it's a frequent and uncomfortable side effect. Okay, so constipation is an expected a side effect, or it's expected cue. And your next gen NCLEX, one of the first things that you have to do is recognize cues and be able to interpret data. You need to be able to interpret whether something is normal versus abnormal, relevant versus not relevant, and if it's important versus not important. Okay, those are the things that you definitely need to do. And with constipation, that is something that is an expected and normal cue that you can expect if someone is taking iron supplement. So make sure you know that. You will probably get a question that says that a patient came to you freaking out, thinking that they have oh, by the way, little insert here. What color does iron make your stools? What color does iron make your stools? This is very important. What color does iron make? Absolutely black. Black tarry stools. Besides iron, what else? What other not medication, but what other event that can happen in the body would also, okay, yep, y'all knew what I was trying to say. Y'all knew what I was trying to say. A GI bleed, blood in the stool. Absolutely. So you can only imagine how many times patients will freak out that they're taking iron and their poop is black and they think that they have a GI stool. That happens all the time. You will be questioned on it because it is such a normal event that happens. It's very important as far as patient education. And for you as a nurse, knowing what's expected versus not expected. That's one of the easiest and the most common things that you will get on the NCLEX. Period. Okay? Just let you know that. All right? Stool softeners are prescribed to prevent constipation. I just want you to know that. Someone said, I can't smell a GI bleed. And that truth, that is nothing but the truth. All right, next question, guys. Great job for everyone that got that one. Let's do, let's do this one. Let's do some ABGs, guys. Someone said, but what if the patient does have a GI bleed? Oh, that's a good twist in events. But if the patient does have a GI bleed, then they would have symptoms that's also accompanying the GI, like the black and tarry stools. Their BP would be low. You know, they would literally be anemic. So those are some things that would make you kind of, you know, go from, is this a side effect of a medication versus an actual, like, immediate concern? That's a perfect thing that you would be questioned on for the NCLEX. So great question. All right, guys, next question. This is fundamentals for 300. Love ABGs. Just kidding, I hate them. It says the nurse reviews the arterial blood gas results of a client with emphysema and notes that the laboratory report indicates a pH of 7.30, a PaCO2 of 58, PaO2 of 80, and an HCO3 of 27. The nurse interprets that the client has which acid-base disturbance? By the way, number 4 is respiratory alkalosis. Sorry. Is it 1, metabolic acidosis, 2, metabolic alkalosis, 3, respiratory acidosis, or 4, respiratory alkalosis? My bad. Which one is it and why? I know 3 and 4 are the same. It's supposed to say alkalosis. I'm so sorry. My bad. Copy and paste. All right. I'm seeing lots of, okay, for the ones that said like 3 and 4, I get you because it says the same thing. Don't do me like that. But I'm proud of you for knowing it. So let's go ahead and see. Let's get into the actual rationale. While I'm doing that, what's the normal rate? You're gonna get it on the next gen, you know, now. But what's the normal range of pH? Okay, tell me what the normal range of pH is. What was that we were doing? Wait for it. Okay, those fundamentals. Boom. Boom, there you go. The answer is 3, respiratory acidosis. If you put 4, I get you because it said respiratory acidosis, but just know that the answer is respiratory acidosis. Okay? All right. And this is why. All right. The normal pH is 7.35 to 7.45. All right. The pH of the lab results that were given was a 7.3. All right. That is below a 7.35. So that would make it acidic. All right. So we already know that the pH is acidic just based off of the pH, you know, that information. Cool. Push it to the side. Next, let's go over. It says normal PaCO2 is 35 to 45. And the value that we got was 58. We got a 58. All right. So that is a high PO2. So we have a low pH and a high CO2, which generally means that you have respiratory acidosis. Okay. If you have the Ultimate Nursing School bundle, you have a little chart. I thought I had the chart. Yep. You have the little chart and little interpreting ABGs right here. Wait, let me put it. Wait, can I? Nope, wait. Yep. Boom. You have a little chart here. This is I printed out from the Ultimate Nursing School bundle. Just letting you know. This little chart right here. Okay, it's going to give you the normal values. That way you can do the tic-tac-toe thing, the arrows up, down, all around. And in the associated page, it lets you know which one is which. And in this case, again, if the pH is low and the PaCO2, carbon dioxide, is high, you have respiratory acidosis. Okay? Great job for all of you guys that got that. Okay. Okay, ABGs. Someone said, where do I find that? It is within the Ultimate Nursing School bundle and the first semester bundle. All right, next question, y'all. Listen, I don't know if y'all are about to take your NCLEX or if you've already taken it, but it's giving, it's giving, I'm a senior, it's giving like NCLEX is nothing to me. It's giving you guys are pros and experts because y'all are not breaking a sweat with these questions, let me tell you. Very proud of you. All right, let's do did I do that one? I don't think I did this one. Let's do this one. Health assessment for 500. Let me move my head. There we go. Boom. There we go. All right. Go ahead and read that. I'm going to read it through what y'all are saying. I take mine at the end of the month. Okay. I take mine tomorrow. Oh my gosh, Kylie, good luck. You got this. I cannot wait for like the next day or 2 days later. You're going to be like, oh my God, guys, it's Kylie RN or Kylie LPN. I don't know, girl, but I have full faith in you. Please keep me updated and let me know when you pass. Keyword, when you pass, sis. All right. We're going to speak it into existence because y'all are killing this game right now. All right. Oh, thank you, Danielle. So I'm a good teacher. All right, so let's read this question. It says, the nurse is caring for a pediatric client who just arrived at the ER department with an extremity fracture. The nurse uses the 5 Ps to assess the extent of the client's injury. What are some of the 5 Ps? Select all that apply. Y'all know the 5 Ps, right? Don't make me have to make a graphic for this, which let me write it down. Is it 1, pallor, which means what? What does pallor mean? After you say your answer, what does pallor mean? Let's go through what these P's actually mean. Pallor means pale. Let the words help you. 2, pain and point of tenderness. Pretty to the point. 3, paralysis, distal to the fracture. 4, pulses, proximal to the fracture site. Or 5, sensation distal to the fracture site. Okay, now even though we are looking for the 5 Ps, do not let the fact that number 5 started being the word sensation, don't let that make you cancel it out. Okay, what's another word for sensation? Like sensation distal to the fracture, there's another word for it that may or may not start with P. So the more you know, okay? Make sure you know. All right, what are you guys saying? 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3. A lot of people are just saying 1, 2, 3, 4, and they are leaving out 5. But let's go ahead and get into what the actual 5 Ps are. I'm not even gonna lie to y'all, I left off 5 too. That's why I'm telling y'all to make this note. Okay? I'm not gonna steer y'all wrong, especially after I've been steered, when I steered myself wrong. So let's look into this answer. And the answer is, let's see who gets it. 1, 2, 3, 5. 1, 2, 3, and 5. First I got a official. Y'all remember that? All right, so 1, 2, 3, and 5. Let's see who got that. Let's see who got that. See lots of 1, 2, 4s. 1, 2, 3, 4. 1, 2, 4. 1, 2, 3. 1, 2, 3, 4. 1, 2, 3, 4. Let me look. I'm going through your answers. I'm looking to see who has 1, 2, 3, 5. Queen Sabria Saunders. Or no, Jewel Marie Jardel. And then Queen Sabria Saunders. Meg. Kayla Denise. Great job, guys. So the answer is 1, 2, 3, 5. That was all of them except the one that said pulses distal. I mean, no. Which one was it? Which one was 4? Hold on. Now I'm going to go through it because it's going to bother me. 4 was, without going through it, 4 was pulses proximal to the fracture site. Let's go into what the actual 5 Ps are. All right. If you don't know this, screenshot it now. Let me bring my head down. Screenshot this. You ready to screenshot it? Okay, cool. After you screenshot it, let's go through what it actually means. It says, if a child sustains a fracture, the extent of the injury is immediately assessed using the 5 Ps, which are pain and point of tenderness. All right, P for P. Pulse is distal, not proximal to the fracture site. That is very important. Let's just circle the block right back. One more. Pulses that are distal, not proximal. to the fracture site. Okay. Whenever you see words that have opposites like distal, proximal, like mild, medium, like all those types of words mean things. They're saying and describing it for a reason. Those are very important, like description words. So I know you want to probably think like, okay, it's the 5 P's. It'd be perfect if it was like pulses that are proximal, because P for P. We can't have everything we want, unfortunately. It would have been perfect for me, but it's not that. Just know it's the opposite. You want to just know that you want to say that it's proximal, but because of that, you should know that, okay, it's not this one. It's the opposite. It is the pulses that are distal, okay, further away from the fracture site. 3 is pallor, all right? Is that extremity pale? Is there no blood flow going through it? That's basically what that means. 4, paresthesia. That's what I meant when I said there's another P, all right? Sensation, all right? That's just another word for sensation. Can they feel anything, all right? Can you feel this from the bottom of your foot? You know, that part. That is paresthesia, and that is distal to the fracture site. All right, and then 5, paralysis. All right, is there movement? Is there no movement? Distal to the fracture site. All right, that's how you get to assess the extent of the injury. Okay, this question is one that you would get during like the first, usually the first or the second question of the NGN case studies, because you're recognizing cues, aka symptoms, signs, and versus, you know, analyzing them and knowing what they mean for this patient. Or it can just be something like a traditional style NCLEX question like this one, where it's either select all that apply or just a multiple choice response. So make sure, besides the content, make sure you know the strategy behind these questions. Okay, this is an assessment question. All right, just remember that. All right, y'all took a picture of that, right? Cool. We're good on that one? I think we have one more. Yes, we do. Wait, I have to make sure y'all see this. If you need to, let me move my head. If you need to, just move like the text in between it so you can see like the number 4 if you're struggling to see it. Just move the chat. Okay. All right. So it says this is IV therapy for 300, and this is our last question. Okay. If you want to play, by the way, if you want to play the full 25 questions of NCLEX Jeopardy, make sure you download my free app. It's called The Nursam. The Nursam, literally. Available for free on iOS and Google Android Play devices. Go ahead and download it. It's free to download. Go to NCLEX Prep. You'll see NCLEX Jeopardy Mobile. You'll be able to play all 25 questions. You have 5 categories, 5 questions per category, each ranging from 100 to 500 points. It's a great fun way to review, either by yourself or with a study group, anytime, anywhere, on the bus, in the car, in the bathroom while you're pooping. It's great. All right. Let's get into this, and that is the Nursam app. Link in bio if you need to for the link. All right, let's get into this last question, guys. It says, a client admitted with hypertensive crisis has an intravenous infusion of 1,000 milliliters of normal saline with 20 milliequivalents of potassium chloride added. A prescription is written to administer sodium nitroprusside by continuous IV infusion. The nurse should plan to do which to administer this medication. 1, monitor the blood pressure every 15 minutes during administration. 2, protect the sodium nitroprusside from light with an opaque material. 3, check the solution for a faint brown coloration and discard it if this is noticed. Or 4, piggyback the sodium nitroprusside into the IV line containing the sodium chloride. Containing the potassium chloride. What is our answer? What is our answer? Not this one. All right. Remember to always at least read the last line of the question so you can remind yourself of what the question is actually asking. It says the nurse should plan to do which to administer this medication. Okay? Boom. Let's go and see what the answer is. All right. What should the nurse plan to do to administer the medication? The answer is what is 2. The answer is what is 2. Great job for you guys that said what is 2. A lot of people say either 1 or 4, and that is okay. We're going to get into why the answer is 2. All right. It says the answer was number 2, which was protect the sodium nitroprusside from light with an opaque material. All right. Hands up. Who's ever even heard of this medication? Raise your hand if you've never heard of this medication. I've never heard of this medication. So, like, me personally, I was like, what the hell is this medication? I don't remember it. I personally just don't. So, whenever, listen, I don't claim to be perfect, okay? And plus, I have hysterectomy brain. I forget a lot. So, if I come across a practice question, and I suggest and advise and recommend that you do this too, when you come across a medication during a practice question that you do not know, that you're not familiar with, after you answer it, or even before you answer it, just throw it in the Google search really quick. Like, just re-educate yourself, or just remind yourself, or even just teach yourself something new. I didn't know what that medication was, so I Googled it, and it treats acute hypertension. I learned something new today. So I was like, okay, cool. Now, with that in mind, let's look and see what the rest of the rationale is. Okay. Automatically, I want to be like, oh, it's an answer. It treats acute hypertension. So duh, I'm going to want to check blood pressure, blah, blah, blah. That's not what the question was asking. Okay. It said strictly about administration. So here it says sodium nitroprusside can be degraded by light and should be protected with an opaque material. It is dispensed in powdered form and must be dissolved and diluted for the IV solution. A fresh solution may have a faint brown coloration, but solutions that are deeply colored, like a blue-green, like if it looks like this, or like dark red, it should be discarded. It's no good. Okay. It says no other medication should be mixed with this infusion. And during the infusion, the blood pressure should be monitored continuously, either through an arterial line or with an electronic monitoring device. All right, note that said during the infusion, aka after it's already been administered. Words mean things. I know it got me too, but words mean things, okay? All right, let me see what you guys are saying. Someone said, is it a pressor? I see how you would think that. Someone said, I think about nitro and it dilates vessels to relax it. And you know that if it dilates, the blood pressure will fall. So yes, that nitro is a good way to think about it because it's a vasodilator. Who said that? Brooke, that was great. That was a great little tool, little tip. Okay, so does that make sense? Megan said we use it in the OR for brain surgery. It's similar to nitroglycerin. Nice. So I had this on my MedX. Listen, ooh, look at y'all. Somebody's raised their foot. I cannot. I cannot. But yes. So yes, the answer was 2. All right. If you did not get that answer correct, do not beat yourself up about it. Just put a little note in your notes for tonight's study session. Look, you just did like 30 minutes of review while you were scrolling TikTok. Like, if that's not the best of both worlds, I don't know what is. Okay, so you can check it off your box for tonight. You've done your studying, sis. Like, you're good to go. But if you guys want to play the rest of the 25 questions, like I said, make sure you download the free app, the Nurse Sam. You can get it at thenursesam.com, or you can get the link there, or you can go to your app store, whether it's iOS, Android, Google, type in the Nurse Sam. It's free to download, free to play. 25 questions, 5 categories, 5 questions per category, all ranging from 100 to 500 points. It's a great game to play while you're trying to go to sleep, while you're waiting for your boyfriend to pick you up. I don't know. It's just anytime, anywhere studying, girl. Like, it's great. RNs and PN students, DN students can use it. Just want to remind you guys of that. Okay, free to download, free to play, the Nurse Sam. All right, so this is the end of our questions for this week. Remember, this was our return to TikTok. All right, I missed you guys so much. We're gonna be back doing weekly NCLEX Jeopardies every Thursday at what time? I did it at 8. Let's do it at 8 on TikTok. I did it at 7 on Instagram. We'll do it at 8 on TikTok. Okay. So if you guys have any questions, let me know. Make sure you check out my TikTok shop so you can see all of our amazing digital nursing school study guides. All right. Specifically the Ultimate Nursing School Bundle and the NCLEX Arcade. All right. Those two together are, you'll pass. I promise. Especially if you're a visual learner and you like to have fun and be entertained while you're studying. Okay. I can't just have boring, I can't just have it while I'm studying, while I'm trying to learn. All right. I need something to grab my focus, to hold my attention. Like, I'm ADHD, so I got to do what it do. So that's why I created all this stuff, really to help people that study like me. I'm a visual learner. I have ADHD. I need to be entertained. I need to actually enjoy what I'm studying. So I make it enjoyable. All right. It's about the experience of studying, guys. All right. We just had a full-on study group session and it was awesome, right? Exactly. All right. Join me next week, same time, same place, right here on my TikTok for next week's NCLEX Jeopardy. Make sure you download that app if you want to play the full 25 questions. They will change next week. All right. They change weekly. All right. Thank you guys so much. And I will see you next time.